This is the lumbar traction machine. So we have these two harnesses that are usually kept in this black cupboard over here. I like to lay them out on the table on top of a heat pack. With these heat packs, we want to have 2 layers of towels plus the extra cushion because it's going to get really hot because they're going to be there for a while. We don't want to burn our patients. So this larger harness is going to go on the lower half of their abdomen, and it's going to catch the top of their hip bones, their iliac crest. And then this smaller harness is going to go on the top half of their body, catching right underneath their rib cage so that they can pull in opposite directions, and that when the machine turns on, it will catch onto those bony landmarks. You're going to hook, once you have them all strapped in, you're going to hook both of these to this hook right here and pull it tight because it's a slip knot. And then up here, you will pull these tight using these straps at the end of each table and also cinch those tight, like that. And then you'll come over here to this machine. You turn it on by pressing the red power button. You will then turn up the pressure, and it will show it right there on that dial how much pounds of pressure it's going to turn up, and they'll be specified by the physical therapist. And it's going to go for 30 seconds, like holding tension, and then rest for 10 seconds, and it'll go for 15 minutes time. And then you'll go hit the start button. After you press start, you want to give them this emergency stop button and the ripcord. Two more things. After you get them all strapped in, you want to make sure you unlatch the table right here. That'll make it so that the table can slide. And if they feel uncomfortable laying flat on their back, we usually will give them this leg bolster to keep their feet and legs out of the way, because this is going to be pulling as well. A demonstration on how to set up lumbar traction. So I like to start with the larger pack to try to get their hips. I'm going to keep it nice and loose until I cinch it down. And then with the upper one, you try to put their arms through. There you go. On both sides. And you want to make sure that the strap catches underneath the rib cage. And it's okay if the harnesses overlap a little bit. They're still going to be able to slide. And so then I like to get all of my buckles aligned and then just cinch them down nice and tight.
With this, it should feel tight enough that it's not going to slip at all if you were to pull on it.
After you have it all nice and tight cinched up on the harness, you'll place this underneath where their feet go so they can have that rested. So you want to make sure the hook is pushed all the way back in because it's going to pull the tension out of the hook. Loosen the knot a little bit so it can slide. Then you also want to get these top hooks hooked in. So I like to clip them in, pull them a little bit tighter. And then, so that they're nice and even, I like to pull them down at the same time. And this is a good test to make sure if the top is going to slip or not, and if it stays nice and secure, you know that you're good. Then you're ready to go and start. Then don't forget to unlatch the table before you start. Then you'll come over here. So you have to turn it on, press start, and then slowly start turning up the pressure. And you can see I'm barely moving it. It's already up to about 20 pounds of pressure. So a slight movement. We'll go to about 30, and if you can't get the number exactly, that's okay. It shall go for the 15-minute time, and it should beep by the end.
All right, so this is cervical traction. So what you're gonna do to get it set up is you're gonna grab this little metal neck board thing. It's gonna be in the corner right over here. It just hooks on right up here. Then you're gonna take the slip knot hook and put it through this hole right here and make sure it's nice and snug. Then you're gonna put a pillow right here so they're not laying on the uncomfortable metal parts under here. Then you'll have the patient get on. And you're just going to grab these straps over their forehead. Is that snug? So on this side, you're gonna turn it clockwise to tighten it. And you want it to be snug, but not pinching at all. So once it's tightened up and they're all set, you're gonna come over here to the head of the machine. You're gonna turn it on. Then you're gonna make sure this dial is all the way down to 0. Then you're gonna press start. And you're just slowly turning this up. It's kind of touchy, so just make sure you go nice and slow to the pressure the PT has specified.
Go to like 20.
Okay, so we're gonna go to 20.
And you tell us if it's too much.
Then, once you've got it turned up to the right pressure, you're gonna give them this emergency stop button. So there's that where you press that red button and it'll stop it. If you need, and then you're also going to give them the rip cord so they can grab us if they need anything. And then you're going to have the PT check your setup before you start it, and then you're good to go.
All right, when teaching patients correct postural cues, you want to make sure that their hips are under their body, so they're not slouching like this or pulling your hips back like this, that their sternum is high, they have slight pinch between their shoulder blades, and a slight chin tuck. A good way to help them not over exaggerate any of the movements is just to tell them, pretend that there's a string pulling their head up so that they're nice and tall. All right, another thing to be watching for when the patients are doing their exercises is just to make sure that their shoulder blades are moving correctly. For example, with the horizontal rows, as they're coming back, we want their shoulder blades to come together and go down. And then anytime that they're raising their arm above their head for an exercise, the shoulder blade will kind of come up and rotate a little bit. So just making sure the patient is aware of that and just watching for it and correcting it as needed.
These are called cervical snags. So what a snag is you're basically using a towel to help get rotation in the joints in your neck, okay? So what you'll do is you'll have the patient grab a towel, and usually what I do is I have them just fold the edge. You can do it a couple times if you want, but usually I just have them do it once. And then what you're gonna do is you're gonna flip this behind their head here, like this. And then with that folded edge, they're gonna put it on the spot where the PT asked. It's somewhere in the neck, right here. And then the snag is just pulling tension on the towel. So if it's a forward snag, all they're doing is they're trying to kind of relax their neck, and then they're putting stress on right on the joint and pulling straight forward, holding it for a few seconds, and then coming straight back off. So it's like a joint mobilization for the neck. So that's straightforward. They can also do a rotational type movement. So they kind of pin one side down to their chest like this, and then they can rotate on that vertebrae up and around like a twisting, and then come back. You're here, rotate up and around with a twist, and come back. And then you could do the same thing technically with a side bend. It's a little bit more difficult, but you're just bending sideways, and then you're getting either a glide up this way or a glide down this way across. That one's less common. The more common two you'll see are forward and rotation.
Other things to note, after you get them all tensed and up, what? Okay. Is it
I don't think you were ready.
I was not.
She wasn't ready.
Which is a lot of pressure.
Just let me know when it's done, Maddie.
You keep going, it's still not really, it's like barely pressing on my left side. I know, yeah.
Work out those finger muscles.
Intrinsic finger muscles.